Thank you very much for coming. I am Nurse Dina. I'm an expat nurse. This is Nursing Cultural Salon, a podcast dedicated to nurses that want to understand nursing internationally, so opportunity, innovation, mainly nursing cultural differences. Today we are with Sister Rosalie Magboo. I'm very happy to have her here. Good afternoon.
Hi, good
Can you see
afternoon, Dina. And thank you for inviting me to your channel.
Thank you very much. We are live streaming to Nurses Move Mastermind, which is our private Facebook group. You can join if you want. We talk everything about nursing cultural diversity and opportunity for nurses. And also you have the opportunity when we go live to ask question to our guests. So let's start with today. Today we mainly talking about research opportunity for nurses and the importance of networking, because I think that Sister Rosalie is a very good reference for that. So Rosalie, I'm so glad you are here with me today. Thank you for support my cause of educating nursing about different nursing culture, showing them new opportunity around the world and helping them find their right place in the world. You are my friends and my mentor. You also were my manager, and I love your leadership style, if I can say that. I remember when I done my interview, I was full of hope because I expressed my intention of doing research and I felt I was capable of doing a career, even having children and even having start nursing again after 12 years experience back in my country. I was assigned to you, which is a great opportunity because when I actually enjoyed the team 3 months after the interview, I had a problem as well, family loss, but despite the difficulty, you support me as we met each other since a long time, even though we just met. And the entire team was very friendly and supportive. The help was exchanged without judgment, but with pride in being part of a solid and robust team. And all members of the team were reflecting your way of thinking what is a team, which is resulting in one of the most professional and healthy team dynamics I have encountered in 20 years of my experience. I greatly appreciate your help and thank you very much, Team 3 as well. I want to say. So, Rosalie, welcome to Nursing Cultural Salon.
Thank you, Dina.
Let's start with the podcast. Let's start with the question. You are clinical doctoral research fellow at Queen's Mary University of London, a member of SCTS, Society of Cardiothoracic Surgery UK, Ireland, and a member of Connect, an international network of cardiothoracic researchers, nurses. And moreover, you are senior sister in the Acute Critical Care unit in St. Bartholomew's Hospital. Can you please introduce yourself by telling us about your career path and also your expat experience? Thank you very much.
Yeah. And once again, Dina, thank you very much for the opportunity to share my experience to your audience and for inviting me in here and for the very kind introduction. And I truly I love our team. And I think that's the other thing that I miss while I'm doing this doctoral research fellow, because I don't have the same kind of team that we used to have when I was clinical. I really miss that part. In terms of my career, I've been a nurse for over 20 years now, mostly in intensive care unit and cardiothoracic surgery. I came to the UK in 2002 as a very young nurse who doesn't know what to expect in the UK basically, is because I was just joining my friends who were all applying to go abroad. And I didn't even expect, what's in store for me. Unfortunately, I was the only one who got accepted amongst our friends, not in London. So all of them are also in the UK, but then again in other parts of the UK. So I was the only one in London. I first started at University College London Hospital. We were one of the pioneers when they re-established the Heart Hospital, which was a really good hospital as well. But unfortunately, it closed down in 2015 because we need to merge with St. Bartholomew's Hospital and London Chest Hospital to create the Bart's Heart Center, which is the largest cardiac center so far, I think, in UK at the moment.
Yeah, in the Europe as well.
Oh, yeah, or in Europe as well. Yeah, so my career, I also work at the Philippine Heart Center, which is also a specialist hospital for cardiac patients, and then moved into here. I did a few years of teaching beforehand, just after I graduated from the university. But I felt that I wanted to experience clinical work and be with the patient, and that's the reason why I moved from teaching to clinical area. However, during the span of my career, I always been engaged into teaching, research, and all sorts of things. For 20 years, I've basically enjoyed working in the clinical area. And that's why I forget that, oh, I really wanted to go to research. So I was basically been interested in research since I was young. So like I've been doing research as early as probably 14 years old. And I'm the only nurse who had a research scholarship at the National University of Singapore in Southeast Asia.
Oh, wow.
At that time, I think I was 16 when I got the scholarship. But unfortunately, because I was the only nurse in the group out of the 30 representative from different parts of Southeast Asia, Australia, and the Pacific, basically, there's no research that focused on nursing at that time. So the research that I did was basically related to clinical pharmacology, which is the closest
Okay.
to the course that
Yeah.
I'm doing. Yeah. So it was unfortunate, but then again, it was a good fun because I had an opportunity. That's the first opportunity for me to do networking internationally, basically, and learn about how to do networking with different people from across the globe at that point. And then obviously when I went into clinical area, I truly enjoyed working in intensive care unit in the cardiothoracic area, and then lots of developments moving from the heart hospital to the Bart's Heart Center. So I temporarily forget that, oh,
Research.
I wanted to do research until obviously an opportunity came up again. And it took me a long time to actually decide, do I really wanted to do it? Because at that point, I felt that, oh, am I too old already to do my clinical doctoral degree? And do I actually need it? But it was a good, I think it was an excellent decision for me to do it as well, because it brings you or opens up more opportunity, not just for me but for my team and to the people that I work with. And we managed to basically bring or make St. Bartholomew's Hospital well known as well because of the researches and the quality improvement projects that I've been doing and been sharing, not just in the UK, but across the globe as well. Yeah, so that's just my short background of how I get into research, basically.
And you be part of these international scholarships too. So you be exposed to the international aspect of the research.
Yeah.
I wanted to ask if your experience as a expat nurse have been hard for you. So it's been hard for you doing things and your career path because I'm a expat nurse.
You mean in terms of the research career?
Both, but yes, research especially.
Yeah.
Please,
So
thank you.
I think as a research nurse, at the beginning, I found it difficult because obviously I didn't know what are the opportunities available for me at that time when I came into the UK. And I think that's why it's important to network basically. For us, before when I started in the UK, there's no specific pathway on how you're going to be doing research basically. So the only option we had is like, yes, you can get involved in small projects or audit in within the hospital, but we were not exposed to the different opportunities for us to do actual research. So it's mostly available for doctors and obviously surgeons, for example, but not for nurses and allied health professionals. And I'm so glad that at the moment they're opening up the opportunities for us as well. And that's why when the opportunity came, I just grabbed it. Although it took me a long time to decide whether I'm going to be able to do it. Also, as you said, as an expat nurse, I think it was again slightly difficult at the beginning because I don't know how to get started basically. And that's why I pursue to become the research lead for the Society of Cardiothoracic Surgery, because I would like to help other nurses and allied professionals to give them direction and to be able to promote and assist them in the development of their clinical academic career, which was also given to me by our clinical director, Professor Judy Sanders. So I wanted to share that opportunity to other nurses and allied professionals who are members of the Society of Cardiothoracic Surgery, and at the same time of Connect as well. Because I think if we know who the people we can go to, and if we know how to actually prepare ourselves, there are so much opportunities out there that we can get basically, but it's just a matter of knowing who will be the mentor and who will tell us what direction we should be able to take. Yeah, so I think I don't know if I answered that, if
Yeah,
I answer your
absolutely.
question. So yes, that's how I feel about it. So
Yes, I think that research took over really in the past decade, especially for nurses. And UK is one country that lead the research worldwide. Is the explanation why maybe before there were no really opportunity for nurses, and then in the past decade we have to build opportunity for
yes,
nurses. So it's not because of expert nurse, but because there were difficulty in general to have a research opportunity for nurses. But of course, being an expert nurse, you understand other problematic that could be up to nurses that want to do research. And actually, learn network from you again. I wanted to say thank you for another thing because I wanted to highlight this. I think this is a very important thing, especially for a mentor and leader. I come from Italy, so we know there is a lot of corruption in Italy. So when I say I know somebody can help you do it something, it's not a very good thing in Italy. So I come from my background that networking actually was a bad thing because it was related to not necessarily criminal things, but it's not a very good thing, okay? That you are able to get something because somebody else helped you, giving back a
a
present or
favor.
something
Yeah,
else.
yeah,
But you actually showed me the good way of networking, which actually is mentoring and leverage together, helping each other. So really thrive each other and leverage skill and competency each other by networking. And if I have a project, you help me. If you have a project, I help you. So I really learn the good quality of networking. I want to say thank you again for this, but generally also for explain to other people and our audience that yes, is a very important thing because when you move abroad, you are an expat. If you have done your research properly, when you move another country, you maybe know something, but you still need somebody else that teach you and taught you
absolutely.
about.
Yeah, absolutely. I agree with
Thank you
you.
very much. So once this and the next question, once nurses reach a certain position or job title, they don't look for new opportunity for growth and improvement in terms of people maybe just look of a job position and a job salary more than opportunity to grow sometime. Of course, I don't talking for everybody, but generally, if they want to advance in their career, the majority of them they usually seek specialization in a clinical area or in management in order
Mm.
to advance in their career. And if we consider also that research requires times and dedication, and just as I said before, just recently nurses are being exposed to more opportunity in research. We see that physiologically nurses are not inclined to pursue research a career pathway. And however, you've been doing research while a nurse, and then you continue study while you were a senior nurse, and then you were also leading a team. It would be helpful if you could explain why and how you were able to do this. If you have a career plan and research since the beginning, or if it has evolved over time. So that we can inspire other people, but most importantly, understand how you were able to lead your team in such an amazing way while looking for research opportunity. Thank you.
Yeah. As I have said at the beginning, I have a special interest with research since I was young. So I wasn't a nurse at that time yet, but I already wanted to do some research of any type, basically. I was doing like laboratory research during the time. However, as you said, there's not much opportunity for nurses. And obviously, when I became a professional, I saw that the role of the researcher or the nurse researcher are mostly concentrated on collecting data, basically, for someone else. I'm not saying it's a bad thing, but at that point, I felt that's not the type of research I wanted to do, because what I wanted to do is that I wanted to lead my own research and not be doing or collecting the data for someone else.
Yeah.
That's how I probably moved slightly on a different pathway, because there is already, when I came to the UK, as I've said, there is already a clear pathway into going to management, as you have alluded earlier on. So this is what you need to do. What are the trainings that you need to do? This is from the band 5, band 6 to the band 7, and how you're going to be able to go into the management. So there is a very clear pathway. And that's basically what has been laid out to us. And then obviously, when I realized and found opportunities that actually there are other opportunities for you to do. It's quite difficult because not many people have experienced the same thing. So, for example, as a clinical doctoral research fellow, I am the second clinical academic fellow at Barts. I mean, for nurses, basically. So it's quite difficult because you don't have anyone to mentor you. What do you need to do? And I am the first, probably, expat at St. Bart's to do it. So what about my educational background? Am I allowed to do doctoral degree now? Do I need to do master's degree if I've done my
Yeah.
undergraduate degree in a different country? So no one has actually ever told me, or no one actually ever advised me on the pathway that I can do. So that's quite, I think that's the difficult part of it. But then again, you, as I've said, you learn as you go along, isn't it? So when the opportunity comes, oh, it is possible actually to do it. And that's why at the beginning it took me a long time, because I wasn't sure, okay, I'm probably worried because I wasn't sure what will be the end result, what will be the career for me after the doctoral degree, and who will be supporting me on
Yeah.
the pathway. But then again, that's when I embark into this career. That's when you meet a lot of people. And that's where I try to do a lot of networking to be able to inspire myself, to find inspiration in other people as well, and to basically get a sense of someone's energy and meet people, or meet like-minded people with the same struggles and
Yeah.
ambitions. And that's what happens. So I met a lot of people. It's not just me. I realized that actually it's not just me who have this struggle. Other people also have the same struggle, but on a different degree. And you learn from their experience, basically. And that's how you actually build on your own career and assert yourself, like, how are you going to move forward? So my vision is, I don't want to just simply become a research nurse who collects data for someone else, who can be like a doctor or a professor in a certain institution, but I want to become a nurse researcher who will be leading my own research.
That's it.
And that's why I decided to do this PhD. Yeah.
Thank you very much. And this affected your way you lead your team. Actually, from my part, I will say no, because you lead our team in an amazing way. So I have nothing, no comment to say. But how's it's been hard for you leading a team while doing this, or you were able
No,
to plan things?
I think it actually gives me an advantage to lead a team, because by doing this, I actually inspired many of our team members, and not just within our team, but with probably the whole hospital, maybe. So many people are coming into me asking opportunities and giving them advice on what projects they can be involved with. I think in terms of the leadership and management, it gives me an advantage, and it's an easier role modeling, basically, for the people. I think I've made I kind of, not to brag on it, but to just to say that I managed to, I think, inspire a lot of people from our workplace, and not just in St. Bartholomew's, but also perhaps across the country in cardiothoracic specialty. And that's the reason why it's easier for me to lead. And for example, in the national audit that we're currently doing with SCTS, it's easy for me to invite them or inspire them to get involved because they can see what I have been doing, and they can basically see what is the outcome of the good outcome of my participation in research, basically. Yeah, so I think it adds on rather than disadvantage. If
Thank you very much. Rosalie, research have exploded in the past decade. UK is one of the leading countries, as I said before, and it seems there are always more opportunities for nurses in research. The question is very straightforward. What are the current opportunities for nurses in research? What is their role? And if there are any differences between countries that you are aware of? Thank you.
yes, it's quite difficult for me to compare with other countries because I haven't done much research in other country apart from my home country. But that's what I'm saying earlier on. We're in nurse research or research nurses, rather, we're mostly concentrated in collecting data for someone else. Those were the main responsibility of research nurses in my country, home country. But then again, which is a supportive or participative role of research nurses. But I realized that the role of the research nurse is more than data collection, basically. So we have a consultative role, we have a technical role, we have a collaborative role, we have investigative role and interpretative roles. And those are the roles that actually are important for you, for someone to become, or for a nurse to become a nurse researcher. So that's the difference between a research nurse and a nurse researcher, wherein you're not just collecting data, but you're also designing and developing your own research and leading your own research. And that's what I wanted to do. And that's what I'm actually doing at the moment. So I have designed my research study from the beginning and will be implementing the outcome of the research study. So that's the difference of the nurse researcher, basically. Yeah, so I think the role of the research nurse has evolved already, and through developing yourself into clinical academic career, then you'll be able to basically become a nurse researcher. And again, the nurse researcher is someone who's designing and developing or leading your own research agenda.
Thank you very much. For the third reason that research has exploded in the past decade, could you please tell us the importance of networking and mentorship in research? Because we already talked about networking and the importance of networking. Can you broaden a little bit and tell us also the importance of mentorship in research? Thank you.
Yeah. As you already know, networking gives you or lets you to get involved and become engaged into something. So it's not just for nurses, but I think for, in general, basically, or not just in research, but in general networking. I think I've mentioned earlier on that through the networking, you'll be able to get a sense of someone's energy and gives you an opportunity to meet like-minded people with the same struggles and ambitions who will be able to provide you good insights into how your profession or our profession can make an impact to our society. So particularly in research, for example, networking gives you an access to job opportunities, professional connections, career advice, new ideas, valuable informations related to the topic that you are researching. It provides you an opportunity to collaborate nationally and internationally. And it also helps you with your personal and professional growth, building relationship with people, and gaining a competitive edge in your chosen profession, basically. So I think that's how important networking is. And as you said before, or at the beginning, and perhaps in some of the countries, they find networking or on a negative part side of it. But actually, I've learned through this journey that networking is something that I need to do because, as I've said, I didn't know who are the people who can show me the correct pathway that I wanted to do. And through the networking, I identify those people along the way. And that's where mentorship comes as well. So you met people
Exactly.
that you'll be able to mentor you in not just in your personal development, but your professional career as well. So mentorship comes in different forms. So it doesn't need to be, it can be one to one or a group mentorship or
Peer
whatever
mentorship.
way. Yeah. So peer mentorship. Yeah. So it depends on you and the mentor that you'll be able to identify. But the most important part is you have to identify who will be your mentor because that person will be the one who'll basically give you an insight of the direction that you'll probably take towards the success of your career.
That conditioning your way of thinking as well. So you
Absolutely.
have
Yeah, that's
to
correct.
choose
Yes.
why. And
Yes.
also, as you said before, you've been a pioneer even in BARTS. You've been a pioneer in research, like a career in research, and networking is helping. And I would say BARTS is one of the trusts that really seeking for research. It comes naturally for BARTS to do research, but networking is good for nurses that are in place where research is not really considered, and maybe networking can help their nurses to actually start a research or start a project because have this power of other people in other place that can show like a base evidence to the trust, can have this as a power live to do their project.
Absolutely. And that's what I'm saying earlier on that networking provides you professional connections and career advice and provides you the opportunity to collaborate. So, again, as in reference to what I'm doing at the SCTS, for example, we have started a project as at BARTS on F-Care Bundle project. And it only started as a simple project at BARTS and now it becomes a national audit because many people realize the importance of this project. And then through the networking, we were able to connect to each other and share to them our experiences at BARTS, which they brought into their own hospital and until it became a national audit already, which is good.
Yeah, thank you very much. It would be very insightful if you could give us an overview of your role now in the SCTS, the Society of Cardiothoracic Surgery, and in the Connect as well, because we already talked about maybe explaining to the audience what this association do and your role, please. Thank you. And maybe people want to join, maybe nurses that are in UK,
Yeah.
internationally with Connect can enjoy. Thank you.
Absolutely. This is SCTS, or the Society of Cardiothoracic Surgery, is an organization for cardiothoracic surgery for surgeons previously, and then they expanded to include the nursing and allied professionals in the organization, which was great. So I am currently the national research lead for SCTS, and my role mostly is focused on encouraging, promoting, and assisting in the development of nursing and allied health professional clinical academic career. I also try to promote research opportunities in cardiothoracic surgery in the UK, and that's why it is very important for me to network because through the networking, I'll be able to provide them this opportunity and identify what are the research activities that's happening across the country related to cardiothoracic surgery and then bring it back to the society and to our members to give them the opportunity to participate if they wanted to. Through the research and audit committee as well, we provide mentorship to our members. So we have a mentorship programs that members can apply to, and then we help them choose the mentors depending on the research that they wanted to do. We also encourage participation in the national audit. As I've mentioned earlier on, we are doing this national audit and AF Care Bundle project in order for us to hopefully be able to reduce the rate of or the incidences of atrial fibrillation after cardiac surgery. Similarly, our role in Connect. So Connect, as you can see on my background, is an international cardiac surgery nursing and allied professional research network. It's free to join, so please join us if you would like. We can share with you
The
the
link
link,
maybe.
to
Okay,
the
if it's
membership.
possible, I'm happy to
Yeah.
share. Yeah.
And similarly, I am a member of Connect. It's a free organization so far. It is being led by four professors in the field in cardiothoracic surgery from different countries. And the memberships are from other, obviously, it's an international. We have, I think, membership from almost 11 or maybe 15 countries with the same interest in research, in cardiothoracic research. So, again, my role there is to help in providing education to our members and help in the mentorship program as well. We also do our own research. So we recently did a systematic review on pain medication after cardiac surgery. Watch out, once it's published, then I can share it with you as well.
Yeah, it would be lovely. Thank you very much.
That's just the overview of my role in research in SCTS and Connect.
So I already ended my question, Sister Rosalie, but I would like to ask you if you have any advice for nurses that want to start their career in research in general, because Nurses Move, this is a platform that help international nurses to move abroad, but because of this, we want to share a lot of information about nursing internationally. So can you give us an advice for nurses that want to join the research?
Or
Regardless if they are international nurses, if they want to move abroad. But yes, thank you.
absolutely. So I think my advice for them is to basically persevere, knowing what you really wanted to do. You need to find a very good mentor. And the mentor does not necessarily need to be on the same organization. It can be, the mentor can be from someone else or even different organization or even internationally. So for as long as they can guide you on the steps that you need to do. Doing research in UK is definitely good. You need to be ready basically if you wanted to advance your career into becoming a nurse researcher. So there are lots of opportunities, or for example, funding opportunities if you would like to develop your career in clinical academics or in research. But as I've said, you need to just ready for it. So when I say ready, so you need to have the appropriate qualification, you have to have the right level of competence, you have to demonstrate your commitment to do it. You have your training and development
Yeah.
plan, and you have to demonstrate plan and support for the next step. So that's why it is important, again, to network and find who will be your supervisor for your clinical academic role. There are lots of funding opportunities, as I've mentioned. It's just a matter of getting yourself ready for the application. But small steps count. So you have to build your portfolio along the way. So, yeah, so just persevere and be inspired. So I think that's the most important.
Thank you very much. I actually have another question, if you don't mind, that I
No,
think
not
is
at all.
important.
Yeah.
Based on what we discussed until now, how can we broaden our horizon in research as a nurse? How can broaden our role in research?
How can we broaden our role?
Yeah, broaden our role in research as a nurse, because you say we now collecting data and you want to expand and be able to build your own research, and how we can do collectively. Do you think there is a way that collectively we can do it?
Absolutely, through
Thank you.
collaboration. Yeah. So I think it's also very important to collaborate because there are certain research that it's better to do in groups, maybe. And perhaps, so for example, as I've mentioned earlier on, we are doing a systematic review on the different pain management after cardiac surgery. And because we have our own job already that we need
Yeah.
to actually do another one could be very difficult. So, through collaboration, you'll be able to share the workload with the other people who have the same interest as you are. So in that way, we are broadening the horizons for us, or the opportunities for everyone as well, and then strengthening the development of research for nursing. So it's quite difficult to get funding sometimes as well. But then again, through collaboration, again, I think it is possible to make an impactful research that will be very useful to the society.
Yes, in fact, and what we say until now, networking, mentorship, and be part of association like Connect or
Yeah,
SCTS really help to connect people and visions so we can pursue the same aspiration and goal.
absolutely. Absolutely.
Sister Rosalie, thank you very much. It's been a pleasure to have you here. You're always so inspiring, and I'm so glad to have you as my friend, as my mentor. You always help me every venture I
Same with
do.
you.
Thank you
The
very
same
much.
with you. Thank you.
Thank you everybody for participate. Before we close, does anybody have a question? Because there is somebody say hello from Rome.
Hello.
But yes, if you like this video, please give us a like. And if you want to know more about nursing cultural differences, subscribe to the channel Nurses Move for more video. Thank you very much. Thank you, Sister Rosalie.
Thank you. Bye bye. Have a good
Thank you.
weekend, everyone.
Yeah.